Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're taking a quick walkthrough of the new Market Stabilization Rule coming out of the federal government. Now, we do have a couple of resources and links for you that you can visit at any time by clicking on that information button that you see on the bottom of your screen. Let's refresh our memory on what we're talking about. Well, there was a rule that was introduced back in February. It was a proposed rule at the time coming out of the Center for Medicare and Medicare Services that wanted to change a couple elements of the marketplace. This was at a time when the new administration was starting early talks of how they might want to repeal and replace the Affordable Care Act. While that conversation was happening, insurance companies were getting pretty nervous about the stability of the marketplace moving forward amidst these repeal conversations. Some early measures were tweaked in the language that could be introduced by rule instead of by legislation. So a proposed rule was drafted that made some changes to open enrollment periods, special enrollment periods, and things like actuarial values and network adequacy that were all part of private insurance plans participating in the marketplace. That rule was introduced in February. It had a very short comment period. Traditionally, comment periods could run for as many as 60 days to allow the public to weigh in on the quality and the content of the proposed rule. This rule had 20 days. It was a very short turnaround. In being short, however, there was no lack of comment. Over 4,000 people in agencies and offices submitted comment on the proposed rule, weighing in. The advocacy organizations and consumers weighing in said they didn't like it. Insurance companies weighing in said they did. We're going to talk through some of the elements of that rule now that that rule has become a finalized rule. Finalized rules will be effective 60 days after publication, and this rule was published on April 18th. So 60 days from April 18th, this rule goes into effect. Let's take a look at some of the elements of this final rule titled the Market Stabilization Rule. The first element, it shortens the duration of open enrollment periods. You might remember when the marketplace opened in 2013, open enrollment was active for 6 months. It was an opportunity to have as many people as possible gain entry into the marketplace. It started at the end of 2013, and in the fall, it ran across the calendar year, and it ran until tax time of the following year, giving plenty of opportunity for people to sort their way through the marketplace, select a plan, pay premiums, get some of the kinks out. It wasn't a smooth operation of the marketplace in 2013, so people needed extra time to try to work through the glitches in the technology that was presenting the plans to them. Then after that, the open enrollment period was abbreviated, but it still crossed the calendar year, giving people an opportunity to buy a plan in the new calendar year of which the plan would be effective after the close of a calendar year, when a lot of patients expressed that they had other obligations at that time. In the original plan for the Affordable Care Act, open enrollment was intended to continue to be shortened until it met a 45-day window. That plan wasn't supposed to take effect for several years. What this rule does is expedite the shortening of the open enrollment period to make it effective for this year. So in 2017, open enrollment will run November 1st through December 15th, 45 days. It's extremely short. It doesn't even go to the end of the calendar year. So this makes it harder for people to enroll in the marketplace. They will need to do it by December 15th for a plan that will take effect January 1st with no buffer in that. A lot of comments have been issued on this particular proposal saying you're going to miss a lot of people. 45 days is not very long, especially if somebody's actually in the hospital during that time. So then the comments started becoming, okay, well, if you are compromised at the end of the calendar year, how easy is it for you to purchase insurance outside of open enrollment, to do it during a special enrollment period instead? Well, changes came to that as well. A lot of the feedback on the changes to special enrollment periods is from advocacy groups and consumers saying this is just an attempt to make sure that those people that were compromised or do have illness or sickness do not find their way into the marketplace. A lot of the rationale that was written into this rule said insurance companies are concerned that people are gaming the system, that they're waiting until they're sick to purchase insurance. A lot of advocacy groups and consumers and disability rights advocates said actually a lot of people aren't waiting until they're sick to purchase insurance. It just so happens that there are a lot of sick people that need insurance and need to get into the market, and trying to play with the eligibility rules to exclude them is actually quite harmful and quite devastating to the stability. It runs counter to the purpose of what this rule was intending. Let's look at some of those special enrollment changes, special enrollment period changes. The first one is it requires a heightened verification period. Everything in your application must be verified before coverage will be approved. The consumer has 30 days to submit verification. Again, this is catering a little bit more to that insurance company interest to make sure that consumers are presenting a package in its entirety before being determined eligible for a special enrollment period. We know that there are particularly challenges for consumers that are working in a cash economy and have difficulty proving some of those verification items like income. There are additional limits on special enrollment periods as well, and this plays more to who's eligible for a special enrollment period. This is where some of the changes might be most dramatically felt. First of all, there's a change to the special enrollment period for loss of minimum essential coverage. Now remember, special enrollment periods were designed for people that had life changes that triggered a special enrollment qualifying event. And one of those was you lost your previous coverage. You lost minimum essential coverage. If that happened, this would trigger a new special enrollment period for you. Well, they've decided to limit that loss of minimum essential coverage entry point into a special enrollment period by saying it can the special enrollment period can't be denied if your coverage was lost to non-payment of premiums in the past. Say someone had private insurance through the marketplace, they were paying their premiums, but then all of a sudden they lost their job or income stopped. And because of that, they stopped paying their premiums. Well, a special enrollment period can be denied for loss of paying those premiums. Now, you can remedy the situation by paying back all of the past premiums that were owed, and then that will qualify you for a special enrollment period to apply for a special enrollment period. And there are a lot of folks that have found some concern with that new tightened eligibility. There are other limits on special enrollment periods. One is that permanent move special enrollment period. You have to have shown that you had at least a minimum threshold of eligibility and had insurance in the past before you moved to then be able to be eligible for a special enrollment period after the move. Now, people use this permanent move special enrollment period after they've moved their household from one location to another. The rationale for allowing a special enrollment period was because that person's most likely going to be in a new area, new state, new region, and therefore a new insurance network. A special enrollment period lets them enroll in a plan that's appropriate for the area in which they're living. Insurance companies were particularly concerned about this, and this was even a change that was made during the Obama administration. Insurance companies said, we think people are moving just to get eligible for a special enrollment period and to buy insurance. This was their prime example of people gaming the system. So the permanent move special enrollment period continues to be restricted and restricted. You have to show that you had insurance for qualifying insurance for at least one day in the prior 60 days before you moved to be able to be eligible to purchase it after you moved. A similar threshold exists for marriage. The permanent rule established the same threshold for marriage. One of the people in the couple engaged to be married must have had minimum essential coverage one day of the prior 60 days before the wedding. If they didn't, marriage is therefore not a special enrollment period qualifying life event. This was because the insurance company's comments said people are getting married just to be eligible for health insurance. Now it's laughable that that's the rationale, but they are now making it more restrictive that marriage itself is not a triggering qualifying life event for a special enrollment period unless you can prove at least one of the couple had minimum essential health coverage before the wedding. Exceptional circumstance, if you thought that was humorous, exceptional circumstance is my new favorite in terms of the humor. You might recall in the past there was a special enrollment period if you could prove that you could not apply for health coverage during open enrollment period because of an exceptional event. An exceptional event is something like a hurricane or a tornado or a devastating flood, something out of your control completely and most likely a natural disaster. The language in the permanent rule has been tweaked. An exceptional circumstance or an exceptional event has to be, and they use the words, truly exceptional. Now, a hurricane alone is not going to cut it. It has to be truly exceptional for you to be eligible for a special enrollment period to purchase insurance because you couldn't do it during open enrollment. I'm curious how this is actually going to play out, what kind of proof or verification is going to be required for truly exceptional as opposed to just exceptional. And finally, just wiped off the books, is a special enrollment period for errors. Now, this is usually errors made by the marketplace or by the insurer. If that happened and you were prevented from connecting to insurance during open enrollment period, you used to be able to get a special enrollment period due to somebody else's error in processing your application or materials or whatever. That is just gone now. That error element is gone. So if you make an error, you could be prevented from connecting to health insurance. If other parties out of your control make an error, you could also be prevented from a special enrollment period. There's new definitions and interpretations of guaranteed availability. This goes to if you owed money to an insurance company in the past, you have to make good on your debts before you can be connected to that insurance company again in the new open enrollment period. There's lowering of actuarial values in the new rule as well. This is what some people at first glance thought might be an improvement. It was a way to make silver plans the new bronze plans, lower the actuarial value of the plans so that a silver plan last year actually looks more like a bronze plan this year, which means lower premiums. People thought, well, this might be an improvement. What it actually means is more out-of-pocket and cost-sharing, lower premiums, so the patient responsibility may actually be much higher. If you have lower premiums, that also means lower tax credits, lower premium assistance tax credits. So a lot of folks are looking at what these numbers actually look like to see what that actually means for the bottom line for the consumer. And it is ending up looking like that's just going to mean more out-of-pocket costs for consumers. We know historically when consumers have a much, much higher deductible, they're a little less likely to go seek that care knowing that it's going to be an out-of-pocket expense every time. Network adequacy. This was a change that's also a little curious. It allows states to decide, state insurance commissioners or regulators to assess network adequacy. It takes that responsibility off of the federal government and now puts that onto states. If states don't really have the authority to do that now, then just an accreditation will do. And a lot of health policy experts are saying that's not enough. There's not consumer protection in that. And it's curious at a time when there's so many areas of the nation complaining that they don't have enough insurers or there's only one plan participating in the marketplace, why this would be the direction that the rule is moving to take away the federal regulatory oversight of that and instead let the states play with it. So it is kind of a federalist argument. The states' rights wanted to take care of this, but they might not be best equipped to do that, especially in an era where we do have legitimate concerns about network adequacy. These were the highlights of the changes in that new final rule. We give you a list of sources. You can view this on that information button where you can read the rule yourself. You can read also a lot of health policy experts weighing in on this topic. And again, keep watch. This will be implemented 60 days after April 18th, so some of these changes will start taking effect right away. Thanks for joining us.